स्पेक्ट्रम ऑटिज्म की टॉक टू द एक्सपर्ट सीरीज में आप सभी का स्वागत है। मेरा नाम शिवाली है। दी स्पेक्ट्रम ऑटिज्म एक सपोर्ट ग्रुप है जो ऑटिज्म के लिए अवेयरनेस ड्राइव्स क्रिएट करता है। इन दिनों हम टॉक टू द एक्सपर्ट सीरीज में ऐसे सभी एक्सपर्ट्स को अपने इस प्लेटफॉर्म पर लेकर आते हैं जहां वो हमें ऑटिज्म के बारे में और डिटेल में और विस्तृत जानकारी देते हैं। And we have the guest with us tonight, Gini Victor. Gini is a speech therapist and audiologist. And let's hear it from her, her journey, how she started and what she's doing currently. So, hi Gini, welcome to Talk to the Expert series.
Hello ma'am. My name is Gini. I am a speech therapist. And if I ask me about my journey, about starting a career in speech language therapy, after the one of our priest told us to do this course, like it's a very different course. You can do something for the society, like So I entered the course. I did my course, and then after the graduation, immediately I got an opportunity to work in one of the super specialty hospital in Goa Medical College. Mm-hmm. And there I started my career to work with a pediatric setup. So I have an experience of 10 years. Mm-hmm. After that, then slowly moved to UAE for a better experience.
Right. So, Gini, your profile mentions that you are an expert in your subject, which is speech therapy. And this group, like you're aware that we are doing an awareness drive for autism. This session especially is about the speech therapy aspect of it. So we would like you to take us through on the moment that the parent realizes that the child is in the spectrum or has any other learning disability. How does the speech therapy, from how early would it start, and what all are the part of the speech therapy?
If we talk about the autism spectrum disorders, so it's always better that they start speech therapy early or consult the pediatrician when they come to know that early signs of autism, that is the absence of eye contact, not maintaining eye contact, not interested in play, not giving joint engagement, or there is no sharing, and babbling is delayed, and there is no gestures or actions, then the child is not initiating any interaction or the simple conversations, like back and forth conversations. So there is it's a possibility that the child comes under the red flags. So if the parents come to know that parents needs to observe these signs and they need to consult early, because earlier it's better the improvement. So there is chances of better language, because the 0 to 5 years is a child's most important developmental period, wherein the child learns to the gross motor, fine motor, and language. So language part, social, emotional all these milestones are achieved during this period. So, and not only that, the brain is also growing. So it's always important and to consult earlier. So speech therapists play a major role in giving the parents what are the strategies or tips they need to work. So it's always better that as early as possible they can consult and identify these signs or at risk of autism.
Right. So speech therapy, if I have to understand it, like somebody who is trying to impart information to a group of parents, or to, let's say, special school or to educators who are into school and those kind of setup, how should I tell them that what all comprises in this word called speech therapy? What all is there? And like you mentioned, different milestone kids miss. But then how does speech therapy help in it, and what all do you do in speech therapy?
In speech therapy, we see that we help the children to communicate. So the main way is like communication is a two-way process, center and the receiver, like, and then the communication, it can be verbal as well as non-verbal. So this is one area wherein we work. We used to see to that, the communication is developed. And then the language part. The language, there are 5 main areas of language. That is phonology, sound awareness of the language. And then the morphology means the morphemes. Suppose if I need to say the plurals, like, ball versus balls. So it changes the meaning, the structure of the word, like, So that is one thing for phonology, morphology, it comes under the language part. So then comes the syntax. Syntax meaning the grammatical structure of language. We need to see that the child is using the age-appropriate grammatical grammars or syntax, like. And then goes to the semantics part. Semantics is a vocabulary, the meaning of the word. So the whether the child having whether the child understands the word, or whether the child understands, that is the semantics part. And then goes to the pragmatics. Pragmatics, which means the social interaction. So social interaction is very much needed for children or anyone, when we are in a social society, like we need to know like how we need to interact with others. So language part, there are two: receptive language, it is the understanding of language, and the expression of the language. Mm-hmm. And also work on with we see that the in higher language, we need to see the age appropriate speech production, speech sounds, whether the child is achieving or producing the sounds correctly, the clarity of speech. So by the time by 4 years, 5 years, most of the consonants, like, they achieve. So clarity of articulation, that is clarity of speech, that is also worked upon, like, we need to see that. So these, not only that, like, we have, it's a wider, like, it's bigger picture, like, we have also see that the child's cognitive level, thinking, planning skills, memorizing things, problem solving, and in addition to that, feeding and swallowing difficulties, whether the children or anyone with feeding and swallowing issues.
I would like to know that I'm running a preschool, so I'd like to know. So when the child is pointing out the things and asking us, so how do we make them do it verbally? They point out things and say, I want this, I want that, and they get it done. But when then we are not able, when we don't give them, give us a temper tantrum. So how do we deal with it, and how do we make them ask verbally?
So if at all temper tantrums occurs, then see, we all start with what the child's interest. We have to go and learn the child's interest. We should not take away their interest or whatever they likes. So if they are pointing it, that means they are initiating communication. So they are, telling you to see, I want that. So you have to model that. Oh, you like chocolate? Or for example, wow, you need chocolate. Okay, you take that and give it to them. Or, that is an initiation. Even if they are attempting to show the signs or, pointing, you can give them. But the next time, like, you can do the next step, like, model them, like, want chocolate. Like that, you can model them and wait for their response to, initiate something.
So what you're saying is positive reinforcement has to be given for a behavior that we want to be repeated. And there is no harm in endorsing the behavior for a certain time by rewarding the child with something that he or she likes. But encourage the child to try to speak in words. Like you said, even if it is 2 words, they want this, do this. So if you do those kind of sentences, even that should be encouraged.
Yes, because that will motivate them, that will encourage them to speak, more and more. Or you can expand their language. Okay, if you suppose the child wants some toy or some, any chocolate, what he likes. So you want brown chocolate, or you can simple the words. You want yummy chocolate. Oh, do you like, wow, sweet chocolate? So you can expand the words. So you can expand the words into, you can model them. So, okay, you can encourage them to, speak more words. Giving more and more language opportunity to talk. So it's not like, you're taking away every time, like, or that is later stage, like, you can remove the this distractions, or whether the child is, more of, you can say, bye, it's over. The time is over. Okay, like that. If the child is showing more temper tantrums or something like that. So the child learns to that this is a time, like, you need this much time you will get to play or something like that, and then give them enough time that, okay, you're going to get only for 5 minutes, and then after 5 minutes, say bye, or wind up, like, finish, done.
So I have a very interesting question here that Sushma has sent across earlier. 5 steps to follow when we try to begin a conversation with an autistic child or a person. So what we should ensure?
First of all, maintain the eye contact. It's not like, you are, at the child's, you have to see that you are at the child's level, physical level. First thing, maintain eye contact, and then you are at the child's physical level, and so that he learns to copy your, or see your facial expressions. That will encourage him to, interact. And or you can hold his cheeks like this, sit with him on floor, and, talk to him directly. So before beginning conversation, you need to see that, so it's not good for the children to, ask them to, like, look at me, because it's difficult for them. They are not, it's they don't program to, give eye contact. But we have to go down at the child's level and talk to them, and give, they learn from so much from the facial expressions, eye contact, from the mouth movements. So you have to go down at that level and talk to them before beginning. You need to see that. And also during conversations, taking turns, back and forth interactions, and see that the conversation before beginning is of a child's interest. And it has to be a fun way. You need to keep them in a fun, motivating way.
So when you're interacting with the child, you can, if he or she is finding it difficult to have an eye contact, you go and hold the face. But then if you're not part of somebody's closer inner circle, when the child is not feeling safe with you, in that case, maybe just being around and showing positive body language, probably the child can read us also.
So diet restrictions, in the sense, some say giving honey improves speech and all that. Is that true? Or there are restricted foods to be given to these children? Food restrictions for these children?
Nothing like that. There is no research. I mean, I'm not aware of any research that says, like, there are certain foods will hamper the child's language development. Nothing like that. But we can give equal amount of nutritious food for the brain development. It is a brain that, giving you need to the language which comes out from the brain. So you need to support the brain development. So we need to give the equal nutritious amount of food that the child needs to receive.
Like, I have seen a kid who was not able to speak clearly, And most of the times when she is not able to speak, she used to throw tantrums and crying and shouting. How to deal with these things, like the anxiety of the kid, how to deal with this?
This is the age of, like, wherein they throw tantrums and all. But for a language part, we will go to the, pre-linguistic skills, like, the skills which are needed before going to the, or at the simultaneously for language development. That is, improving their imitation skills, play skills, eye contact, joint engagement, shared enjoyment, or something like that. So for 2 years, 2.5 years child, like, we need to see that why the child is throwing tantrums, or the child needs attention, or what is the reason behind. You have to see that. And it is, you need to work on all the areas, behavior that can happen in during this age, like. And you have to see why, the reason for the temper tantrums, and we need to work. So whether the child is not able to, because whether the child is not able to communicate, that's the reason, or initiate any communication, that's the reason. That may be the reason. It can be that's why she's showing frustration or throwing tantrums. So we need to, as a professional, we need to find out, so parents play a major role in this, like in initiating communication, and developing children's language. So if the children lag behind in language development, then they can through these frustrations or tantrums.
Thank you so much, ma'am. Thank you.
Okay.
So there is a very interesting question, and this is about how long does it take for a child to start speaking words who doesn't speak at all?
It is, we cannot predict about how long it will take, but definitely the quality of treatment, the quality which the parents give. So that is very important. So if the child has a delay, the age matters. What is the diagnosis? What is the level, child's level? What is the child's cognitive level? So what are the issues the child is facing? Whether the child is having sensory issues, behavior issues, or any other issues. So we need to see all these, problem difficulties. So then only we can predict, like, how well the child will do. And not only that, the parents play a major role in, helping the children develop their language faster. So giving the child like quality time, as well as, professional help will help them to, achieve achieve language, or speak clearly.
A lot of the families have multi-languages that they speak. So maybe a family has a regional language, and then they have English and Hindi as the language that they speak normally outside the house. So being multilingual, does it help or hamper, or it has no impact on the speech development of the child who is in spectrum or has any sort of learning disability?
Actually, the bilingualism does not affect any, like, hamper the language development. But in fact, it very much helps in, if you learn many languages, it's good for the brain. The children become smarter if they learn because the children's learning time, most of the brain development happens during the 0 to 5 years. In that time, like, if the children learns many languages, it's good for them. 80% of the language growth, brain growth occurs during that time. So it is always good for the children, like they become smarter, they become creative, and it helps them to, plan well, and, moving tasks, and cognitively also, it helps them a lot. It has got, many benefits. But the thing is that it depends on the parents and the background. Like, if the parents want their child to learn in, mother tongue, always the preference will be given to the mother tongue. So if the child's mother tongue is suppose Hindi, so let the child learns that language first, and slowly go into the other language. Or when they enter to the preschool level, then we can introduce English. So like that, if both the parents are using two languages, then one parent can choose one language and then the other parent can use the other language, so that the child learns to communicate in both languages. And it is always work in coordination, like, giving them commands, instructions in different languages. It won't be difficult for them. So if they find it difficult, like, coping up or following instruction, is always, I would suggest that to make them learn one language, mother tongue, that is their mother tongue.
Right. So that makes quite a lot of sense. That speak as many languages as possible, but one person uses one language. So the child learns to take the commands or the instructions from that person in that particular language. And therefore it helps the child pick up multiple languages.
Multiple languages.
Right. So I have another question, and this is about stuttering and stammering. How far can this be corrected by speech therapy?
Stuttering is disfluencies, like, when they speak, they have repetitions of sounds or blocks or prolongations. So actually it affects their quality of life. But we cannot predict that we can completely cure them, but we can just help them to maintain, like reduce their symptoms or issues, help them to give them direct strategies, like to help them speak fluently, and then give them the enough counsel them, like to build up confidence. So it is and not only that, it always depends on the factors wherein, like the research says that wherein the boys can have more stuttering than girls. So the age which occurs, like the onset of the stuttering, if the stuttering occurred earlier, then there are more chances like it remain for forever, or there will be some sort of stuttering symptoms, like characteristics. And then the other thing is that the family background, like if the child, most of the times, like they are the stuttering occurs due to the family, or if the child is having some family members, or then it can it can reoccur. So it is always like the speech therapy does not 100% cure, but it always helps them to like maintain a level.
Yeah. So this question that I have in mind is typically to not to do only with the learning disability kids. I am looking at the preschool or the play school kind of kids, where the approach is this Montessori approach, or the otherwise that we do. I think it starts very early there itself, when we're introducing sounds to kids. And there also these small activities that the teachers do in school, which helps the child associate a word, a formation of word and alphabet and the sound attached with it. So likewise, what are the speech therapies that parents can pick up either from school or from a speech therapist that they can practice at home? Something that, if I have a child who has a speech disability, something that's been taught at school, can I as a parent also do the same thing at home to enhance the growth and development of that particular skill that the child is learning?
So what they learn is that pre-literacy, what we call before moving to the main school, like, they learn a lot about pre-literacy skills. So there are many areas the teachers can focus, like, the parents can also include is that the creating more of a print awareness. Print awareness in the sense like the word, if you suppose a McDonald's or KFC, the label KFC, the child is learning to learns that the word contains letters of the alphabet. Is the print awareness. The child, without reading, they know that they come to know because of the print awareness. So including more of books, textured books, or they can make their own books and in pictures, colorful pictures. So nowadays research says that if you introduce books early as 6 months, it is better for them. We are preparing them to be successful, academically successful, or better reading, better writing. So the language is the foundations of literacy. So it is always we can predict how much the child can learn. So before the print awareness or the pre-literacy skills that they need to work on is that develop more. In teachers also can talk a lot about things what is related to the child, everyday situations or everyday activities. The activities which can include in schools is that teach the children to sing songs, action songs, or circle games, participate in conversation, simple conversation, or social, creating social stories, or teach them simple stories every day. So these are the things they can even preschools as well as teachers can also do for the language development. This is in respect to the language development, but there are other things they can do it. I have seen some schools, they don't do pre-writing, or that is like occupational therapy is related, but before going to writing, but they can also do the pre-writing skills, develop the fine motor skills or something like that. So the book, shared reading, what I will suggest is that shared reading, falling into conversation, talk about books, talk about pictures, talk about print. So all that, it leads to a success, academic success.
Yeah, and this can be done at home also, because not every time it is possible for parents to engage a speech therapist, because it is a costly affair. For certain parents cannot really cope up with that kind of frequency. So if there are small things like toys that can help with the kids, if they can buy those kind of toys at home, and the child can learn to this building blocks, or those needle and thread wala, where you have to put the needle across the loop, the ball which is around. So those kind of things which will also develop the gross and finer motor development, and the brain also gets conditioned. So not every time, not that I'm not saying that you should not go for speech therapy or occupational therapy, but a lot of things that parents can also pick up and do at home, which I'm sure most parents do once they identify that the child is in spectrum or has a learning disability. So I think as a community, we should also be aware of, when you find a child with some sort of learning disability, and if we can offer something like that to the child, where he or she can play it along with the friends, and we educate our kids also to, get involved in those kind of games which the child feels comfortable doing, and it enhances that social learning also. So Mayal has a question. What is the right time to mix an autistic child to a group of children?
It's always as early as possible, because if they and considering the level of the child and the issues, if they are okay to settle down in the new groups and they are accepting other children, as long as they are accepting, and it's always better, and it's always good that they enroll as early as possible, because it will help them to, there are many skills that can be developed through enrolling or mixing up with other children, like peer groups, creating peer groups, or developing social interactions, taking turns. That when you interact or when you initiate conversation, you need to consider, develop taking turns. All those skills can be developed.
I've heard many people place humongous trust on oral motor therapy and have heard it great success rate. What is it actually, and how does it help, and what is the success rate?
Actually, oromotor therapy is mainly done for the feeding and feeding issues. So in order to prepare them for the, improve their oromotor skills, suppose they have some, feeding issues like sucking, swallowing, and chewing, or the mouth movements are restricted, the main like lips, jaw, or tongue restrictions. So we work on the coordination of these oral structures.
What message you want to give to schools, especially the preschools, which focus on early development of a child, and what activities or approach they can train their faculty for grooming an autistic child?
Involve a lot of pre-literacy skills in children, and then for schools, like they need to have resource setup if possible, and they need to have one visiting speech therapist, or special educators, or occupational therapist, psychologist. So these team of professionals can always help them or guide these preschool teachers in planning and planning for or developing the literacy goals. So there is something called a individualized education plan. So that also sometimes with the difficulties, like we need this team of professionals to plan and create goals according to the functional needs of the child.
Right. That's quite an important message. I'm sure we have a couple of educationists here. They would have got their messages very clear. Here on behalf of the core team of the Spectrum Autism, all of these are wonderfully talented people. Some of them are educationists and they are social media influencers also. So I thank you, Gini, for coming over and giving us this important message and such wonderful information that you shared. So thank you so much from the team, and have a wonderful time ahead, spreading the happiness that you're doing through your work. So thank you so much, and thank you everybody.